You're listening to episode 46 of the Fed and Fearless podcast. On today's episode, we're talking all about the fertility awareness method with Lisa Hendrickson-Jack.
Hi, I'm Laura Schoenfeld. I'm a registered dietitian and coach trained in functional medicine with a passion for helping women just like you ditch perfectionism and use food, fitness, and self-care to fuel your bigger God-given purpose. I believe that it's possible to achieve your biggest life-changing goals without the frustration, obsession, or negative self-talk that so many women subject themselves to every day. All you need are the right tools, the right mindset, and the faith to turn your dreams into reality. I'm here to guide you along the way. The truth is that you are so much more than a body, and I'm on a mission to help you change the way you think and act at a core beliefs level so you can transform your physical, mental, and spiritual health from the inside out. Are you ready to become fed and fearless in your pursuit of a healthy, meaningful life? Welcome to the Fed and Fearless podcast.
Hey everybody, welcome back to the Fed and Fearless podcast. I'm Laura Schoenfeld. I'm your host as always, and as usual, we have a really awesome guest interview for you today. It's someone that I have just been following, I think for like 6 years now, and have just been loving what she's been putting out into the world, not only on her website and her podcast and her social media, but also in her amazing book, which I learned from this interview was self-published, which was pretty amazing. So today's guest is Lisa Hendrickson-Jack. Lisa is a certified fertility awareness educator and holistic reproductive health practitioner who teaches women to chart their menstrual cycles for natural birth control, conception, and monitoring overall health. In her new book, The Fifth Vital Sign, Lisa debunks the myth that regular ovulation is only important when you want children by recognizing the menstrual cycle as a vital sign. Drawing heavily from the current scientific literature, Lisa presents an evidence-based approach to fertility awareness and menstrual cycle optimization. She hosts the Fertility Friday Podcast, a weekly radio show devoted to helping women connect to their fifth vital sign by uncovering the connection between menstrual cycle health, fertility, and overall health. Now, Lisa and I had a little bit of trouble with the recording on this particular episode. Zoom was being a little crazy. So you're going to hear that my audio changes about maybe a third way into the episode. And Lisa was so gracious to put up with the tech issues I was having on my end. So I just wanted to let you know in advance that the audio quality is not going to be as good as usual, but we're going to work on that, see if we can get that fixed so that next time it'll be just as good as what you've come to expect on the show. But even with the audio quality issues, the interview is awesome. Lisa is so knowledgeable, and I just love everything that she has to share in her book, The Fifth Vital Sign. And I know that she's working on some new content and new books and all of that awesomeness. So I'm really excited to have her on the show. So stay tuned. All right, everybody. I am so excited to have with me on the show today, Lisa Hendrickson-Jack. How are you doing today, Lisa?
I'm good. Thanks so much for having me, Laura.
Yeah. And before we started recording, we were talking about how I apparently was one of your first podcast guests ever several years ago. And it's crazy because it's just like, it doesn't feel that long ago. And you have such an amazing popular podcast now. And it's just really cool to see what you're doing and the mark that you're leaving on the world and the impact that you're having on women's health. So if anyone's not familiar with you, can you just explain who you are and how you got into the world of fertility awareness?
Yes, thank you. Yeah, it's so fun to see how things have changed. And it's also been really fun to watch you grow your business and grow your following. So right back at you. But yeah, so I discovered fertility awareness at a pretty young age. I was right out of high school. I had been on the pill for heavy, painful periods. And when I actually needed birth control, I didn't feel comfortable relying on the pill because of a few different reasons. One, I didn't take it at the same time every day and I was super nervous. And the other was that because I did have some challenges with my period, I knew that it wasn't fixing it, because I would sometimes go off of it and the problems would still be there. And so I just didn't want to be on it for the foreseeable future. So right around the time I was having these self-discoveries, I discovered that I wasn't fertile every single day. So I discovered fertility awareness, and it really changed the way I looked at everything. And it made me realize that what I'd been taught about my cycle has nothing to do with how my body actually works. And so I started out just by using the method myself. And then very quickly, I started teaching other women. I actually was part of a group of women. We took a training class in my early 20s, and we were teaching this grassroots level. And I never actually thought that it could be something that I would actually, have a career. I just couldn't envision that, partly because that was almost 20 years ago, and all of these wonderful tools that we use to connect didn't even exist. So, fast forward to, after I got married and my husband and I were starting family, I really kind of took a look around. I had been able to take this information for granted for nearly, a decade at that point. And I just really felt, I kind of looked around and saw how many women are experiencing fertility challenges. And so that's what really prompted me from taking it, from the grassroots level, to see if anyone would really want to hear what I had to say. So started the podcast, eventually wrote the book. And it turns out a lot of women want to know because it's just crazy to me even now to think that, my journey began almost 20 years ago, right around 20 years ago now. And still to this day, the average woman has no idea how her body and her cycle really works.
Mm-hmm. Well, I remember I read your book last year when it first came out. I think it was like last spring, right? That it was fairly new to the market.
Yeah, January.
Yeah. So I read it when I was on vacation, and it's not one of those types of books that I would have expected would be like a vacation read, but I just found it so interesting, and like I couldn't put it down basically. So it's funny because I feel like so much of the fertility awareness books up until recently were so almost like textbook kind of heavy. And not that that's a bad thing, but not everybody wants to read a textbook, right? So I just loved the way that you made everything so not only simple, but really just fascinating. It's just crazy how so much of it is not stuff that we've ever learned before, assuming you just had like normal sex ed and normal health stuff when you were in school. So your book is called The Fifth Vital Sign, and I would love to hear from you. Why do you call the menstrual cycle the fifth vital sign?
Well, I call it the fifth vital sign. It's not, to clarify, it's not just me. I didn't make up that idea. It's more and more professionals are starting to recognize the menstrual cycle as a vital sign. And so if we think about the most commonly accepted vital signs, so your body temperature, your respiratory rate, your blood pressure, your temperature, we all have a sense that first of all, we know that there's a normal range. And so if your temperature is too high or too low, not only does it tell your practitioner that there's something going on, it gives them a specific roadmap as to what to look at. And many of us don't realize it, but our menstrual cycle essentially does the same thing. So when you are a woman of reproductive age, you should have a menstrual cycle, and it should be fairly regular and consistent and not problematic. You shouldn't have a lot of pain. You shouldn't have, out of control PMS symptoms. And if you do, or if the cycle isn't normal, if it isn't regular, if it's all over the place or something of that nature, then it really does indicate that there's something wrong, similar to any other vital sign. Only we're taught to ignore any cycle irregularities, whereas with our other vital signs, we're of course strongly encouraged to look at them.
Yeah, it's really interesting that you said that, because I always think about something like body temperature. If you were running a fever all the time, or if your body temperature was like 95 on a regular basis, no doctor would ever be like, oh, you're fine, just ignore it. Or let's give you some Tylenol that you can take every single day that'll bring your fever down. So I just feel like with women's menstrual health, it is really that situation where it's either, that's quote unquote normal and just ignore it, or, if you want to make it normal, just take the birth control pill. So, it's funny with the fifth vital sign piece. Again, I feel like it's more of the women's health world that's pushing that, as opposed to something that you would hear from a normal doctor. So I'm really glad that there's people like you out there that are sharing that information. And even beyond the menstrual cycle and menstruation, I think something that really tends to confuse a lot of women is the difference between having your period and actually ovulating. So can you talk a little bit about why ovulation and not just having a period is so important for women's health?
Yeah, that's such an important point, and it's really unfortunate, I think, because menstruation is the most obvious sign of the menstrual cycle. We tend to focus on that. But beyond that, women are really sold the idea that being put on the pill is the same as having a period. So for the record, when you're put on the pill suppresses ovulation, and most hormonal contraceptive methods suppress ovulation either entirely or partially. And what that means is that it shuts down your natural cycle. So when you're on a hormonal birth control method, you're not having a cycle. And instead of having a cycle, you have shut down your cycle, and then you withdraw the artificial hormones for a couple of days, and that causes a bleed. So that's an automatic bleed. That is not the same as your period. It's basically your body's response to the sudden withdrawal of these artificial hormones. And so with that said, I think that is what kind of leads to a lot of confusion, because first of all, we're not even told about ovulation and the things that are happening in the cycle. But second of all, we kind of think that when you're on the pill, it's the same thing. So ovulation is in many ways the event that we should be paying attention to, because without ovulation, you can't have a true menstrual period. And when you understand how the cycle works, in the first half of the cycle, so after you have a true menstrual period and you move into the first half of your cycle, your follicles and your ovaries are starting to increase in their production of estrogen. But basically, those hormones, you only produce significant amounts of your natural estrogen and your natural progesterone in your menstrual cycle when you actually ovulate. And so I think a lot of women don't realize that ovulation is how we make hormones, to borrow, the very common words of Laura Briden, who talks about it that way all the time. But it's how we make our hormones. And beyond that, there's this idea that our menstrual cycle is only related to our ability to make babies. And so that idea that if we're not actively trying to make a baby, that it doesn't even matter whether we're ovulating or not. And what's interesting is that we have hormone receptors for estrogen, progesterone, and these fantastic reproductive hormones throughout our entire body, in our bones and our breasts and our brain, all throughout our body. And so those hormones affect our functioning. And I think the analogy that I use the most to try to drive this home is, if I'm buying a car, I can opt to have air conditioning or not. And whether I have it or not, it's separate parts, so it doesn't affect how the engine works. And we kind of think that that's how our body works. So we kind of think, I can take the pill and shut down my ovulation, even though most of us don't really know that that's what's happening. But we kind of think that it just affects the reproduction part. So if I do that, it's not going to affect me at all. When you look at the long side effect list, then it kind of makes sense if you think about it as an actual part of your body that can't be separated. How else could it affect your mood and your sexuality and even your choice of a partner, your chance of depression, all of these other, nutrient deficiencies? Potentially, we could even talk about some of the sexual side effects of reducing the size of the clitoris and, the labia and also the vaginal opening. I mean, it obviously has more to do than just with reproduction. And so I think that's kind of one of the biggest myths about our menstrual cycle that is perpetuated on us, that we're basically only here to make babies, and that's the only purpose of our reproductive cycle. And it's just completely not true.
Mm-hmm. Yeah, I always wonder what a man would say if a side effect of a medication was like, may make your penis smaller. It's like, not really sure I want to take that medication. So, and actually, I think that leads perfectly into another question I wanted to ask you, which was, what are some of the risks associated with hormonal birth control methods?
Yeah, I think that, I went through a few briefly. One of the things that people may not realize is that some of the most common side effects of birth control, one of the most common, is depression and anxiety. So the mood related side effects. So, if you look at the insert, the drug insert, you might see mood changes, but that's kind of an understatement. And when you look at the research, one of the studies that I quoted in the book, teenage girls who are on the pill are significantly more likely to be put on antidepressant medication. And of course, that for me, knowing and understanding that the pill is associated with these mood changes, if you will, you would hope that the physicians would be aware of that. And so if a teenage girl came into their office with signs of depression, you would hope that the doctor would really look at, okay, let's look at any medications that you might be taking. We know that the pill could be associated with depression. And so, if you're on the pill, then maybe you could go off of it for 2 to 3 months. If you're sexually active, have a backup measure, but let's just see if it could be related to that before putting them on antidepressants. But I think we all know that that's not what happens. So that's a really important effect. And I also want to point out, over the years, I've interviewed a number of women who have shared, some women go on birth control and they immediately feel these side effects. So some women go on it. Some women who are listening right now are shaking their heads like, yes, it was me. Like, you went on it and all of a sudden your emotions were up and down. You were crying, you were angry, you were happy. And, you realized right away that this is different. Other women go on it and potentially the long-term effects, the gradual nutrient depletion eventually catches up to you. So some women start developing these effects 3 months in, 6 months in, 1 year in, 5 years in. And I've spoken to women who 8 years in start developing panic attacks and really start to, they had this gradual pull of anxiety that they couldn't really explain. And they just attributed it to their own neuroses, right? Like, it's just me. But at some point it got so bad that they chose to go off the hormones to see if it could be related. And lo and behold, the panic attacks come to a halt. So that's one aspect, but obviously I'm emphasizing it because it's so important. I mentioned nutrient deficiencies. That's huge. And I'm not sure that, for me, again, this is something that I feel it could be highly mitigated with a detailed conversation with the prescribing healthcare provider. So, taking vitamins doesn't solve the problem of the fact that the hormonal birth control is negatively impacting your ability to synthesize and utilize these nutrients. But at the same time, knowing that it depletes vitamin B12, folate, vitamin B6, so all of the B vitamins, but those are 3 that are particularly evident in the research, as well as magnesium, selenium, like it just goes on, coenzyme Q10. So knowing that ahead of time would at least give women the opportunity to take prenatal vitamin. Even the link to depression is really interesting because some have theorized that it's related to the significant depletion of vitamin B6. And some women then, when they're on hormonal contraceptives, find some relief from some of those symptoms by addressing the B6 deficiency, among others. So, this has significant implications. It's right there in the research. And again, the question is, why aren't we talking about it?
Mm-hmm. Well, and if you think about it, either it should be recommended when someone's given the birth control pill to take a multivitamin, or, you would think they could probably just build it into the to the birth control if they wanted to add a little bit of B6 or something to help balance that out.
Well, it's funny that you mentioned that.
Oh, yeah?
Because there's actually, when I was looking at the research, so the brand Yaz, so they actually came out with a brand called Bay Yaz, and it contained folate. And what I find to be the most interesting, so when I was going through the studies, so like anything, you can find multiple studies that show that hormonal birth control depletes folate, particularly in the long term. So the longer you take hormonal birth control, the more likely you're going to have this deficiency because it builds up over time. But if I wanted to design a study that showed either inconclusive results or that showed that it didn't, then all I would really have to do is design a 3-month study, so a short-term trial, and allow the participants to take vitamins. And so when I was when I was looking at the research, you kind of see that because there's a lot of short-term studies that will say, oh, there's no link. But again, to go back to Bayaz, the folate containing hormonal contraceptive, it's like on the one hand, they're saying it doesn't really make a difference. And on the other hand, they're putting folate into which is it? Does it just in case or not? Mm-hmm. And of course, I stand on the side of, well, the evidence shows clearly that it does, especially when you look at the studies that examine the ways in which women take them. Most women are not on birth control for 3 months.
So it's interesting to me that you mentioned that a lot of the research on hormonal birth control only goes for 3 months. And yet so many of these issues that the women that you interviewed that came up, a lot of them weren't necessarily experiencing those issues within 3 months. Do you know if there have been any long-term safety or side effect studies
on hormonal birth control?
Well, I mean, of course there are. And I can't say that I've looked at all of the research, but I certainly dug deep with a variety of topics. And I think this just speaks to, so I think there has to be a balance between actually listening to the lived experiences of the human beings that take these medications, and also with the science, because the science is really important. I mean, it's the foundation of my work, your work. It's all very evidence-based. But at the same time, we have to be able to look at those studies with a critical eye, meaning that it's not enough to just look at one study or look at the abstract. You really have to, if you're looking at a particular topic, in my opinion, you really want to go deep so that you can understand. Because like I said, there's a lot of studies, and again, a lot of short-term studies that show, oh, there's no, link. And I address that in the book in a short kind of section there, because I say there's a lot of studies that show that there's no link. And then I cite like however many of them, if a person really wants to dig into it, and then I say, but there's a lot of studies that say that they do. And if you look at the difference between those studies, well, when you look at the long term, you're going to see different results. And I would say one other thing that I think is important is that when you have a study, you have the science aspect of it, but you also have a human being who's doing the study, who has their own biases, just like I do, when they're looking at the information in the data. So one of the studies that I looked at that was looking at side effects. So first of all, I was already upset when I read the title, because the study was designed to identify the characteristics of the women who complained about side effects. And I'm sitting here thinking, you've got all this money to do studies and this is what you're studying? So I'm already annoyed. But, and so the researchers then, they go through, they do their study. They find that 50%, half, 1 out of every 2, I'll say in every way possible, emphasize, women had side effects from the pill. And many of those were emotional, many of those were sexual, but a variety of side effects that they obviously not good. And so the researcher concluded at the end of the study that it was difficult for clinicians to recommend birth control and share the side effects without unduly discouraging the participants from taking it. So if I was the researcher, perhaps my conclusion would have been that that is an unacceptable amount of, women who are having side effects, given my biases and the way I look at the world. Potentially, if I had done that study, I would have said, wait a minute, that's really high. If half of the women in the study are having side effects, maybe we should actually put some time and energy and effort and money into figuring out why that is, and potentially developing a better formulation that doesn't lead women to feel so unsatisfied. But no. So I think, again, when we're looking at research, you have to have that critical eye and really understand what they're looking at, look at the results, but recognize and remember that the conclusions that they're coming to are based on their own experiences. So you know what I'm saying. I'm saying science is not infallible.
Yeah. Well, I feel like I remember reading this because, again, it was about 1.5 years ago since I read the book, but it's almost like the conclusion of the study was that, hey, it's going to be kind of hard to get women to take birth control if you explain to them all the things that can happen when they take it. I don't know if the full conclusion was like, here's how to say it so that they maybe won't be as nervous or as, resistant to it, which, I mean, it's wild to me because I work with so many women who are given birth control for reasons other than contraception. And we'll get into the whole contraceptive piece in just a few minutes here, but just the idea that you're kind of, it's almost like whack-a-mole, where it's like you're trying to fix one problem with this medication that then ends up causing a bunch of other problems. And the question in my mind is, what is the benefit for someone who's not having a regular cycle to take birth control to get a quote unquote regular cycle, which you and I both know it's not actually doing that, and risking all these side effects? What is the actual benefit? Now, if somebody's got something like a really bad endometriosis and their pain is significantly reduced with birth control, that's a situation where I think, okay, the benefit is outweighing the risk. But when I work with women who are dealing with like hypothalamic amenorrhea or PCOS, and the irregular period is a sign, like you said, a vital sign that something's going wrong, and the birth control is really just masking that. So not only is it not fixing the problem, but it's also causing new problems. I just don't personally understand, like, why is this still being recommended? I don't know if you have any thoughts about that. Or if you're just like the same as me, I have no idea. Good question.
Well, of course. I mean, I've had a lot of time to think about these issues. And one of the things that I love to do, I always joke, like whenever I get my hands on a doctor, the first thing I want to ask is like, so tell me what happened in med school, because I want to understand why this is how we do things. Like, why is this how we handle period problems? And so over the years, I've interviewed a number of doctors, and it's just fascinating. So, in my opinion, the reason that this happens is because, from my understanding, I didn't go to med school, but, from my understanding, the pill and hormonal contraceptives are presented as a panacea. And essentially, they're taught about what a regular cycle is, air quotes, 28 days, ovulation, day 14. And anything that is outside of that can just be regulated with the pill. And so it's presented as a very benign medication. I would say, and at one point when I was doing research, I came across this document that was intended for physicians, and it went through the side effects. And based on my perspective as I was going through the document, it really presented this idea that we need to be concerned about the life-threatening side effects, which obviously we do. And so it really highlighted those, but in a very specific way. So if you're over 35, if you're a smoker, So basically not acknowledging that it does increase certain life-threatening risk factors all across the board. So really emphasizing, this is really when we have to pay attention to this. And also, if this individual has an issue in this area, recommend a progestin only. Like, so it's still put them on hormones, but we need to know like which contraceptives are. So it's really within that, like, everyone needs a contraceptive, but you need to know which one to, prescribe in a certain case type of thing. And it really, in my opinion, did minimize those effects. So I think for many physicians, they're not overtly taught about all of these anxiety, depression as being a real thing. Chronic yeast infections, it's just not really emphasized. And without that emphasis, then you end up with because this is not a problem at an individual doctor level. This is not something where, the occasional woman goes to the doctor with period issues and is put on the pill. This is a standard way that it's treated. So that would be why I think it happens. And, to add another layer to it, what is allopathic medicine, right? It's a pill for every ill. It's not really designed to see the body as perfect and to see it as a fully functioning, self-sustaining unit, and to see illness, even in general, as a sign of an underlying disruption or some sort of imbalance. The system is just not designed to look at the body that way. And so, of course, it's very challenging for women who are kind of attuned to that and who are doing all kinds of things in other areas to try to improve their health. And then as soon as they have period problems, to be sent to a doctor who basically tells them that there's nothing you can do. If you have painful periods, that's just what you have. And we're just going to put you on this pill for the rest of your life. And I just wanted to touch on what you said, because I'm like anti-pain. So I used to have really horrible, painful periods. So, I don't think anyone should have to deal with pain. But one of the questions that I often have, because of course, then for women who have severe endometriosis or pelvic inflammatory disease or some issue that is causing them to have horrific periods, and the pill is the only thing that's ever brought them relief, I still have the question of, what percentage of those women do have side effects? What if they are taking it for that and it is helping, but they are also experiencing anxiety and depression? So when I think of those things, I really think that it can be used as a tool on your path to healing. And I would hope that it wouldn't necessarily be the permanent forever solution. And it would be something to help you. It's like a bridge. So while it's so horrific, you take it so that you can function, as well as getting support to really start addressing those underlying factors. That's my hope for the world and for every woman who has horrifying period pain.
Yeah, definitely. And I would say the main thing is to just, and I don't want to have to add an asterisk, because I think people know that you and I feel this way, but the idea that we're not demonizing anyone who does take birth control, or not saying that you're, dumb if you do. It's just the number of doctors that recommend it as like the first and last stop on a woman's journey to improving hormonal health. It's unfortunate that that's the case, but we want to educate people so that they know when they're at the doctor and that's the option that's presented, that is not the full picture, and that they don't have to do that as the first step, or maybe they never have to do that as a step if they don't want to. So, because I know sometimes when you talk about medication, there's always someone out there that's going to be like, oh, you're going to make me feel bad about taking medication. It's like, no, we don't want you to feel bad. We just want you to be educated and know that you have options and that you're fully informed, because I think the informed consent piece is not even part of the conversation in a lot of cases. Most of my clients, I don't know about, the women that you interview or work with, but most of them would not say, oh yeah, my doctor went through this list of like 50 different potential side effects I could take before they put me on the birth control. Usually they're just like, writing a prescription like, oh, no big deal. Everybody does it.
Well, and just to, jump in there as well. I mean, I work with women at a lot of different stages, and particularly because of what I do, I work with a lot of women who are coming off of birth control for a variety of reasons. Some of them have discovered fertility awareness charting, and it's like, wow, I can avoid pregnancy without hormones. This is great. So I work with a lot of women who are transitioning, and I also work with a lot of women who are planning to get pregnant. And so again, for the women with endo, I just feel like I completely agree with you. And that's why I started by saying I'm anti-pain, because I've experienced that horrific pain. The way I described it before I had children, so I have two boys, I said, I felt like I was in labor with no baby at the end. I'd be exhausted. I would need to sleep for, a couple, like it was really bad. And so then I went through labor and I was like, I didn't even know I was in labor. I was in labor with my eldest son all day. And I did not know until I knew, but like all day. And so this is not okay. So I feel like for a lot of women, when I talk about this stuff, I may be one of the first people in their life, or you, Laura, as well, to say like, yes, it's common. Yes, a lot of women experience pain, but it's not actually normal. And we shouldn't actually expect that is it. And I like what you said, like the first and last stop. I think that, and it's kind of my philosophy in life, we need to do what we can based on what we know. And then when we know more, we can do more. We have other options. So for a lot of women, yes, like get on the train. Like we need to not have the pain so that you can function. And then continue learning. Don't stop learning. And don't let anybody tell you that there's nothing we can do. That's it. This is your lot in life. All of that is nonsense, because there are plenty of women who have been able to overcome this. And so for the woman who has endo and who's basically told that's it, and the pill's the only thing that has ever brought her relief, what happens in 10 years when she wants to start a family? Like at some point, it can't just be like, and you're going to be on the pill for the foreseeable future for the rest of your life. I feel like that we should just deserve, we deserve better. And again, just never stop learning, never stop believing that you can be healthy.
Mm-hmm. Well, and what I love is, I know we have a lot of like just average women listening to the podcast, but then we also have healthcare providers that listen to this podcast. And I just love that so many more women's health experts are getting educated and understanding this stuff, so that when they have a client that comes to them, they can actually educate the client, and the client is not the one that has to do everything for themselves. Because again, your book is awesome and it's super easy to read, and I think everybody should read it. So, it's one of these things where it's not as difficult to get educated as it used to be, but it still puts a lot of burden on the individual to have to make all of these decisions for themselves, and also to go against what their doctor is recommending, which I know can be very stressful. So I just think it's great that so many healthcare providers are demanding that we do better and are educating themselves so that they can help their clients make the best decisions for them. And again, maybe that is using birth control, maybe it's not, but having the information is what is the most important thing. And like we were saying, that informed consent piece. Now, I would love to switch over into chatting about the fertility awareness method. I know that's like your jam, that's your expertise. And it's something that I'm trying to think if I was ever taught about it in any like non-personal, personal or professional development situation. I don't think I learned about it. I'm in my early 30s, so I'm like trying to think back, 15 plus years to think about if I ever came across this stuff as a teenager, young, in my 20s. I personally use fertility awareness with me and my spouse, and we're not trying to get pregnant right now. We may in the future, which if we do want to get pregnant in the future, we'll just kind of switch the focus a little bit with what we're doing. But I would love to hear from you, just a quick overview of what the fertility awareness method is and how does it work for helping women either avoid contraception or become pregnant if they want to be.
Yes, of course. I love talking about fertility awareness. And it really starts with understanding how your cycle works. So in order to understand fertility awareness, there's a few myths that we typically have to overcome. So a lot of us have been taught that you could get pregnant on every single day of the menstrual cycle, which is ironic because it's actually men who are fertile all the days, all the time and all the days. So when men go through puberty, from puberty onwards, essentially, they make sperm all the time. But as women, we have a cycle. And so from a scientific standpoint, there are 6 days of the cycle where pregnancy is possible. And so that's because as we approach ovulation, we produce cervical fluid. Cervical fluid keeps sperm alive for up to 5 days. And then we have the day of ovulation. So ovulation does happen on only one day of the cycle. And so, 5 + 1 is 6. And so from a scientific standpoint, there are 6 days. And so there's research to support that as well, of course. And then when you're using the method for contraceptives or for contraceptive purposes, you add, a buffer period. So the actual time that you have to abstain from unprotected sex, if you're using the method for birth control, is more like a week, depending on your cycle. So the basis for fertility awareness is essentially understanding that there is a fertile window, and you can identify that fertile window using the main 3 fertile signs, which are cervical fluid, basal body temperature, and cervical position. And essentially, you can track that. So the major part of fertility awareness is tracking your cycle. So tracking these 3 main signs. And so there's tons of charting apps. When I started, there were 0. And I had a spreadsheet that I actually made books in my 20s and gave them to all my friends and sold a couple, like 2. So it's a little bit different back then. But either way, you're tracking these signs, learning to identify when in your cycle you're fertile, when you're not fertile, and adjusting your behavior accordingly. And what's important to know about this method is that it's not the rhythm method. So we often think that, the rhythm method is an actual method of birth control, but it's really based on calendar calculations. So it's based on the idea that, I'm going to look at my last 6 cycles. I'm going to identify when I think I ovulated. And then from then on, I'm just going to avoid based on the timing. Whereas fertility awareness is observational. So you're actually observing your fertile signs each day and making those decisions based on what you see. And what's also helpful to know is that it's based in biology, how the female body actually works. And it's also based in science. So there are, peer-reviewed studies. There's a lot of research. There's a lot of information. I think a lot of women are surprised to find how much science is behind this method. And so it's really helpful because if you're wanting to avoid pregnancy, the efficacy rate, so one of the most commonly quoted studies is the Frank Herman study that they looked at the symptothermal method, so combining the 3 main fertile signs that I mentioned, and the efficacy was 99.4%. Granted, these were women in the study who were trained by specific educators in a specific method, so they followed the rules, and this was the outcome. But that gives a lot of hope to women who have often thought that the only way that they can prevent pregnancy is with birth control. And because I've been in this field for quite a while, and I'm starting to feel old, I guess. I'm almost in my 40s now. But what's interesting to me is that when I was contemplating, contraception, when I was in my late teens, early 20s, when I went off to university, I never had the idea in my head that it was like hormonal contraceptive or nothing, like hormonal contraceptive or pregnant. And I feel that now in this day and age, something has really shifted. And so there's really this idea that if you're not on contraceptives, you're automatically pregnant. And that's the only option that you have. Even condoms aren't really taught about as effective methods of birth control anymore. And so I kind of scratched my head to know how we got here. But I think we all know how we got here. I think that birth control is very lucrative. And I think that there's a lot of financial benefit to putting every single woman on earth on a contraceptive. So I feel like it wasn't necessarily for our best, highest health. And I think we need to be aware of the shift that has happened in terms of convincing us that there's only one way to prevent pregnancy.
Mm-hmm, definitely. I'm trying to think, because again, back, what year would that have been? That would have been early 2000s, high school, the whole sex ed thing. And I know I went to a school that was actually pretty progressive, very highly educated staff and everything. And I don't think we ever learned about any of this stuff. We did learn about things like condoms and all the, various options there, but that's a little sad to think that the message is getting pushed to just birth control or nothing now. And also, so we were talking obviously earlier about the side effects of birth control, some of the negative things that can happen, the way that it doesn't really fix any of the health problems that are caused by, I don't even know if I want to say caused by, it's almost like not having a regular period is a symptom of the other issues going on. And of course, we know things like hypothalamic amenorrhea can be associated with things like low bone density. The research that I've done on that is both the low hormones and the nutrient deficiencies that often come from HA and the female athlete triad are what leads to the bone density issues. So birth control actually doesn't even fix it. That's always a surprise that my clients, when they find out about that, a lot of times that's why they were put on the pill in the first place, is the doctor's like, well, we want to protect your bones. And unfortunately, there is no evidence that it does even protect bone density. So, thinking about the side effects and the lack of benefit of the birth control pill, a lot of people, they might be thinking, well, what if I'm not sexually active? What would fertility awareness do for me? Is there other things that they could benefit from beyond just, the pregnant, not pregnant kind of situation we were just talking about?
Yeah, absolutely. This question comes up, the way I think about it, it comes up when women ask me, when should we start teaching this? When, should we teach fertility awareness to teenagers? And I think we should give every teenage girl the opportunity to learn about her cycles and to chart independent. I think one of the challenges for a lot of people is to think about charting independent of sexual behavior. So to answer your question, there's so many unanticipated aspects of charting that I see my clients benefit from. So, from the most basic level, we talked about the menstrual cycle as a vital sign. So there's a lot of benefit in charting your cycle, understanding what your normal or your baseline is, learning about cervical fluid, understanding that it's normal and natural. So how many women, so for the listeners who may not be familiar, cervical fluid, you produce it as you approach ovulation, typically for, anywhere from about 2 to 7 days. It can look like creamy white hand lotion. It can look like clear, stretchy egg whites, raw egg whites. If you were to stretch it between your fingers, it forms a thread. And sometimes you'll just notice that when you go to the bathroom, it's super slippery. So there's a couple things that are important to know. How many women have ended up in their doctor's office thinking they have an infection because of this discharge? And how many of those doctors have then go on to prescribe antibacterial or whatever, probiotics or antibiotics or, whatever the case is, because they themselves may not have been educated. So I've, again, had many conversations with doctors, and often the concept of discharge is always bad. And if you're not really taught about cervical fluid and how it's normal and natural and you produce it during that time. So from a very practical standpoint, it's helpful to know the fluids that come out of your body. And as a teenage girl, one of the greatest fears that I had, I'm sure everyone else had, because our culture isn't exactly welcoming to bleeding through your pants. So the biggest fear for a teenage girl is getting their period unexpectedly. And a lot of girls go on the pill so that they actually know when their period is coming, not even for any other reason other than I don't want to bleed unexpectedly. And so how useful would it have been to be taught that you produce cervical fluid around ovulation, and then once you ovulate, it actually dries up and you get your period 12 to 14 days later. And you can learn to understand that this is very reliable. And every teenage girl could then use this information to know when her period is coming. I feel like that's the holy grail. And of course, understanding and knowing how your body works and understanding all of this is independent of sexual activity. There's inherent benefits in just knowing that. For grown women, I think that what I find with my clients is that my clients typically do come for a practical purpose. So they come for the birth control, they come for the, conception. It's obviously helpful for conception. But what happens is they start to learn about themselves. Because when you start to track your cycle and you start to see that you may have different energy, most women do have different energy as they approach ovulation versus afterwards. And they start to tie these things together. They start to see that how they interact with life in the world, whether it's diet, exercise, whatever it is, it actually impacts their cycle for the better. a lot of women, unfortunately, do have issues with their cycle, do have issues with PMS, do have issues with pain, or all kinds of different things that come up. And when you start to see that your behavior, your choices can directly impact your cycle for the better or worse, it puts so much power into your hands to be able to just decide, to know that you can make a difference. The amount of women that I've worked with who reduce their period pain, who reduce their PMS symptoms, who start to see that, oh, I had no idea when I work out 7 days a week, it shortens my luteal phase. And wow, I didn't have any idea that when I skip breakfast every day, it lowers my temperature. There's just so much you can learn. And all of these things just empower you to really start to take control of your health and your cycles. I just feel like it's such a huge paradigm shift for so many women. So of course I am biased because I personally have been charting for 2 decades and I've worked with, hundreds of women over the years to do the same. But I really can't understate that women really, it's like the iceberg analogy, like you really see the birth control at the top, but there's 90% more underneath that you wouldn't have even thought that the doors that would open up from charting.
Mm-hmm. Well, and that's one of the things I loved about your book so much is that it went into all this information about like things you can be looking for to know if something's wrong or to know that something's normal or, all of the things that, again, maybe have nothing to do with whether or not you want to get pregnant or not. And sadly, I feel like so much of women's health revolves around whether or not you're wanting to get pregnant, right? It's like, it's not about, oh, how do you feel on a monthly basis? Or what are your emotions like? Or what is your energy like? That kind of thing. It's all like, do you want to get pregnant or do you not want to get pregnant? And that's the only thing that matters. And I know I've learned a lot personally from doing I probably don't do as much like active charting as maybe you would, or what you would teach someone if they wanted to be a little bit more precise about things, but I do use the Daisy thermometer and we probably are a little bit more overly cautious with using like contraceptive, like, barrier method, that kind of thing. But it's one of these things where I just have learned so much, and I want all my clients and all my friends to know about it too. And it's not just because it's a contraceptive or it's an alternative to birth control. It's really understanding how does your body work, knowing, even for me, it's kind of silly actually, even for me, if I have a couple of days where I feel a little bit more irritable and more low level of patience with my husband or something like that, I can like open my Daisy chart and be like, wait, where am I on my cycle? And be like, oh, I'm like a couple days away from getting my period. It kind of makes sense. I have to chill out a little bit. Like I need to like be mindful of me being a little snappy, but now I understand why I'm a little less patient in the last couple of days. So, cause I tend to be really busy, and that's why I really love having the app to just kind of open and check in on it and say like, oh, why do I feel tired? Or why am I a little bit, a little bit irritable today? And for me, I used to have, I don't think I had anywhere near as bad of periods as you did, but I did have some pretty significant PMS earlier in my early to mid 20s. And nowadays the symptoms that I have are so subtle that having that knowledge of what I'm looking for actually really helps, because I don't have these like really problematic couple of days before my period that are like very clear. Oh yeah, you're about to get your period. Now it's really subtle. So I'm like, wait, where am I? Like, what day am I on? So then it's kind of like, I need that data to actually remind me, oh yeah, you are going to get your period in a couple of days. So that's why those things are happening. So it's a cool experience to be able to have that literacy in your body. And I feel like, again, I didn't learn it. And a lot of it I didn't learn until I read your book. So, it's kind of like top of my list for women's health to understand their bodies and understand what the things mean that they're seeing and observing. Gosh, I feel like you answered so many of my questions that I had prepared these questions and you already answered them in some of the other answers that you provided. Can
I just jump in with something?
Yeah, definitely.
Well, because we're talking about a lot of the subtle, like light and wonderful things that you can learn. And I just want to point out as well that having an understanding that there's such a thing as a normal cycle is something that most women don't have. Even just understanding that there is such a thing as a normal cycle, so that you know how to identify what's abnormal. Because sometimes it's as simple as, PMS that's a little bit out of control. But other times, so there's a couple of examples that I can think of. So there's a certain type of discharge, like a wet, watery discharge that women have and experience throughout their cycle. So because of the detailed type of charting that I teach, I feel like I honestly don't know of another situation where you actually would pay attention and detect it. So for example, you're wiping all the time. If you're wiping all the time anyways, everyone listening goes to the bathroom and wipes. But when you're checking, for your cervical fluid, for example, and you're wiping intentionally and you're looking, there is the symptom where women who have abnormal cervical cells will experience this wet, watery discharge. And so I've spoken to a number of women over the years, and if they've had a full-on positive PAP and they know they have cervical dysplasia, and it's on like the higher end, they may actually experience what they describe as like gushes of water. And this does not happen around ovulation because, with the charting apps, it's like wet, sticky, creamy egg white. And so a lot of women just think, oh, it's wet, it's great. But if you're, you've already ovulated and your period is coming in during that time, you're experiencing these wet gushes of water. So wouldn't it be helpful to know that that's not normal so that you can go get yourself tested? That could be the difference between early detection of cervical cancer. So I just want to give a few examples, that example. And of course, a lot of women don't know that painful periods aren't normal. A lot of women don't know that it's not normal to bleed, at random times. And those types of things can, help you to identify quite serious conditions. I just released an episode with one of my clients, actually. She's in one of my programs and we did an episode. But in her experience, she was even on the pill. And when she was on the pill, her pill periods got to be so heavy that it brought her to the doctor multiple times. And it took multiple times for them to do testing to determine that she actually had leukemia. So we could talk about the fluffy. I love it. But I think it's also helpful to know this is why it's important, because for our general health, if men had a biomarker like this, it would be on billboards and we would all know about it and we would all be talking about it. So for women, we have to, in my opinion, of course, I think we need to be aware we have this incredible biomarker and we don't have to obsessively chart it, but we need to be aware of it so that if there were, whether it's mild or serious issues, this is one of the windows into your health that can give you these types of significant insights.
Mm-hmm. Well, I'm glad you mentioned that. And I feel like just understanding your body in general as a woman is so important. And I hate to make it all about like women, need to like fight against the system or whatever. But sometimes just knowing that there is such a dearth of research on women's health issues. It's not something that's been studied very heavily up until the last, couple of decades that they've really been putting more attention on women's health issues specifically. And just because there's not research on it doesn't mean it's not happening, right? So there's I'm sure you've had this experience where you talk to someone about symptoms that they had or an experience that they had that there wasn't this like randomized controlled trial that was describing exactly what was going on. But when you know your own body, you know when something's wrong or when something is not normal. And that is one of the best benefits of doing the regular charting beyond the birth control or the contraceptive piece. You get to know what's normal. So then when something isn't normal, then you know that there is something that needs to be checked into, even if it's just like a fluke, right? Like it's not always, I don't want people to think that if their cervical fluid ever changes during the month, that means they have cancer. Because I know sometimes people can get a little nervous about that kind of stuff. And not that I think you were saying that or that your book says that whatsoever, but you notice patterns. It's really more about like, what are you used to seeing? And then now all of a sudden you're seeing something different. You know that could be an issue and it's worth getting checked up. Maybe it's nothing, maybe it's something more serious, but I know so many women go without getting the care that they need early enough to really prevent more serious issues or to catch serious issues before they get worse. And like you said, I think it could really save a lot of lives, honestly, if women were taught to know what to be looking for and to understand. Again, we're not saying common versus uncommon, because unfortunately, I think a lot of things that are not normal are very common with women's health. But just to know that, hey, if you're experiencing this stuff, this is not normal. And this isn't something that you should just say, well, I guess this is just the way it is. And that's how my body works. And I'll just pop a bunch of Advil before my period or something like that to avoid these symptoms, but not ever really figure out what's actually causing them. So it's very important. I'm glad you brought that up. So I could talk to you for a long time. And I know our audience, I'm sure, would love to hear more from you. And I know you have a very popular podcast that's been going on for several years at this point. And as I mentioned, the Fifth Vital Sign book is probably one of my top, I don't know if I can say like how many. Like, it's definitely probably top 5, maybe top 3 as far as the books I would recommend for women understanding their bodies and understanding health. Is there anything else that you would love to share with our audience before we just talk a little bit about where they can find you and get connected with you and learn more from you?
Yeah, I guess we covered a lot today. I would say that the great thing about fertility awareness, I mean, you would think I would be the person saying everyone needs to do this and everyone needs to use this as their birth control. And that's not at all actually what I think. I think every woman has the right to learn about it. And I think that, you know, women who really resonate with it, if you find yourself really resonating and, you know, oh my gosh, this feels so right, I've been looking for something like this, then I would want you to know that you can absolutely do it. And, you know, don't look for permission from your physician who didn't really learn about fertility awareness. So again, in my interviews, doctors are basically taught, you know, similar to how most of us are. They lump in fertility awareness with the rhythm method and those types of things. So I would just say, know that you can do it. Don't doubt your ability to do it. There are a lot of women out there. If this is new to you, then welcome. And as soon as you start looking for support and information, you're going to just be amazed at how much information is out there and how many women are doing this. So I suppose that's what I'd want to know. I want you to know. And also that, yeah, it's not necessarily for every woman at every single point of her life, but I do feel that especially for the clinicians who are listening, the professionals, you know, it's not to say that every woman should do it this way, but every woman has the right to know about all her options. You know, Laura, you were talking about informed consent. And I think it's really helpful, really important for all the clinicians to start just talking about it. And I think it can be really frustrating for doctors in particular who know about this, and they, you know, they might really want to be sharing all these options with their patients. And it's like, no, I just want ID. That's nice. I just want ID. And that's totally fine. But you just don't know the power of being the person who just listed this option on, you know, as one of them, so that she heard that and knows in the future, someone told me something about this fertility awareness. And you just don't know the power of that. So that's what I'd want to share.
Mm-hmm. Yeah, it's something that, like you said, you don't have to push it, but as long as people know that it exists. And I mean, listen, if I have girls, if we have kids, I'll definitely be teaching them about it when they go through puberty. Because at the end of the day, if a girl can get pregnant, you know, I get that there's going to be different perspectives on abstinence and that kind of thing. And we do have a lot of Christian listeners on the show. So we're not saying anything about, you know, if abstinence is an appropriate technique or, you know, whether people should be having sex before marriage. But the fact is that just understanding your body as a teenager just gives you so much power and understanding of, like, you know, what's going on and what to expect and what's normal, what's not normal. And, you know, like I said, I think it would be really cool if we had a sex ed system in this country where women actually learn this stuff. And then, like you said, they get to decide, if you want an IUD, there is that option. You don't have to not use a more pharmaceutical contraceptive method. It's just, if you don't even know that you don't have an option, that doesn't seem to be right, you know? So I know that Lisa's work is probably one of the biggest influences on that I'm aware of. And I love it. And so I hope that all of you that are listening will check Lisa out and check out her book. We'll definitely link to the book in the show notes. Like I said, I think it's like top 5 minimum of books that I think all women should read about their health and their body and that kind of thing. I think you mentioned before we jumped on that people can download the first chapter if they want to.
Yeah, you can go to thefifthvitalsignbook.com and grab the first chapter for free. And of course, I did it in audio and the paperback and the ebook versions to make it accessible. And thank you so much, Laura, for your kind words and glowing endorsement. That means a lot. It's just, it was, you know, I think that you can, just from reading the book and following my work, this is obviously a passion of mine, because I see how it can impact women's lives. And to speak quickly to the teenage kind of aspect of it, it's like, imagine what it would have been like for all the women listening, for your first experience with your body would have been a positive one, where you learned how amazing it was. And not to have it necessarily tied. I mean, of course, the reproductive creative aspect of that is amazing. But to have it just presented in a positive light, independent of sex, just this is what your body can do. Isn't this amazing? This is what you can learn from paying attention to your cycle. Even just like, this is how your energy changes throughout the cycle. And you might want to take a bit more of a rest before your period comes. And that's okay, because that's just how your body works. I feel like there's so much opportunity, right? So anyways, I just wanted to share that because it's wonderful to see the impact that it's having.
Yeah, well, and like I said, absolutely love your work, and so happy to be able to share it with the audience. And if anyone's interested, we'll link to Lisa's website. We'll link to that first chapter of the book that she mentioned, her Instagram, which you always share really awesome, interesting stuff there as well, and your podcast as well. How do you remember how many years you've been doing it? Like, do you know offhand?
Yeah, when I hit the end of the year, this year, 2020 is the 6th year. So
wow.
It's, and over 300 episodes. It's interesting. This is what happens if you just stick with it. So I've released an episode every week since I started. And it's been really fun. Laura, you can, I'm sure, attest. You learn a lot from interviewing people. It is an incredible just wealth of information, and it's certainly changed my views about so many different things, opened up my eyes to so many different things. And I'm just thrilled to be able to share it. It's incredible. So I'm excited for your podcast as well. I was so excited when I saw that. I mean, you had a podcast, but when you started your own podcast as well.
Yeah, it was one of those things where we took a break from our old one for a while, and I started to feel like I was missing it, because it's honestly my favorite way to create content, and I love interviewing people. So I definitely agree. Like, it's really awesome to get to talk to people with a variety of different expertises, and just to expose my audience to different voices that maybe they may not have heard of before, or wouldn't have heard of if I hadn't necessarily interviewed the person. So it's just a really cool opportunity, and I guess a benefit of owning your own business and being able to talk about what you want to talk about, and not feeling like you have to censor yourself or anything like that. So it's awesome. All right, well, Lisa, I really, really appreciate your time and expertise and everything that you do. For those of you who were just hanging out with us for the last 45 minutes to an hour, thank you for spending that time with us, and we'll look forward to seeing you here next week on the Fed and Fearless podcast. Take care, everybody.
Hey there, Laura here again. Thank you so much for listening to the Fed and Fearless podcast. Your time is your most precious resource, and I'm so grateful that you choose to spend some of it with me. Now, if you're enjoying the podcast and want to continue supporting my work on this show, I would very much appreciate it if you would leave a review on iTunes. By leaving a 5-star review, you'll help others find the show and help me spread my message to a larger audience. You can go to fedandfearless.com/review to find a button that'll take you right to iTunes to leave your review. And I have a special gift for you as a thank you for helping me share the podcast. Once you leave your review, send a screenshot of the review to hello@lauraschoenfeldrd.com. Or you can DM it to me on Instagram @lauraschoenfeldrd. Once you do, I'll share a free copy of my Overcoming Undereating ebook. Then share a favorite podcast episode in your Instagram stories and tag me @lauraschoenfeldrd. And I'll also give you a free copy of my 14-day calorie challenge recipe guide. Together, these bonuses are worth $44 and will help you become Fed and Fearless. And you'll get them absolutely free for just helping me grow the podcast. Again, thank you so much for your support, and I'll see you here next week for the latest episode.